Hello, everyone. Welcome to our October COVID-19 briefing webinar for healthcare providers. Before we get started, we would like to learn more about you in terms of where you work, your professions, and whether you had participated in these webinars before. So please do fill out the poll by clicking on the Q&A button at the top right of your screen, and we will then review the results in just a few minutes. Can we move on to the next slide, please? Thank you. So my name is Dr. Cindy Shen. I'm a public health physician at York Region Public Health. I'm very pleased to be presenting this COVID-19 briefing webinar with Krista Richards and Kim Bakani Angus, who will be sharing some information on their health equity work. This is our fourth monthly COVID-19 webinar, and through these sessions, we really hope to provide healthcare providers in York Region with some local and provincial updates, and hopefully to answer some of your questions as well. And as always, a very big thank you to our team here who put this together, Sarah, Brooke, and Emily, along with our corporate communications partners. Next slide, please. So to note, this meeting will be recorded. During the meeting, you'll have the opportunity to ask questions and share your thoughts in the chat box, which we will be monitoring. It's not open to everyone to see each other's questions or comments, and your name will not appear on the screen to attendees. That being said, the producers and presenters may have access to this information. If you have any questions about the recording of this webinar, you can contact us at the email address shown here. After the presentation, there will be some time dedicated to questions and answers, and we'll try our best to summarize and answer as many questions as possible. If we don't have the time to address everything, any outstanding questions will be compiled and a Q&A document will be sent out through Public Health Matters. So please do subscribe to this. Along with the document, we'll also email out the slides for this webinar and information on future webinars. So please subscribe and also tell your colleagues about this as well. We're really trying to reach as many York Region providers as we can. Next slide. So how do you ask a question? You can select the Q&A on the right side of the screen and type your question in the compose box and then select send. Questions will be screened by a moderator and then posed to the presenters. Next slide. So you have some time to fill out the poll. I know it's only been a few minutes, but let's find out who are participating in this webinar today. So perhaps we didn't have a lot of time so far. So far we've received responses from 9 people, though there may be more on the webinar. And in terms of where you practice, you can scroll up a little. Perfect. So it looks like a lot of people are from Newmarket, but really we have representation from most of the other municipalities as well. And in terms of your professions, most are physicians in primary care, but also we've got allied health professionals, nurses, physicians who are specialists, and other professions as well. And it looks like about half of you are actually returning to our webinar, so that's great news for us. And thanks for filling this out, and welcome to you all. Next slide, please. Okay, so moving on to the presentation, here is what we'll be discussing today. I'll be going over the latest epidemiological information on COVID-19 in York Region. Then there will be some updates from the province, including new public health measures and revised guidance documents. And following that, we'll take a look at what's new with testing. And a standing item given this time of year is, of course, flu immunization. There will also be some information related to other vaccines. And lastly, as mentioned, Kim and Krista will speak about health equity and COVID-19. Next slide. So we'll start with epidemiological update. Next slide, please. York Region is seeing a sustained high number of cases and outbreaks. This graph shows the number of confirmed COVID-19 cases reported over time. And as you can see, since September, there has been a consistent and drastic increase in the number of cases reported, and our case count is at an all-time high. The latest 7-day average of new cases in the community from the period of October 20th to 26th was 98, with a test positivity rate of 4.9%. So we know that community transmission is happening and is quite active, and close contact outside the household should be avoided. Unfortunately, we have been seeing quite a few cases linked to social gatherings, with attendees then spreading the virus to their own family members, workplaces, etc. In addition, we're seeing an increase in the number of cases in all age groups, with the highest rate of increase observed in those in their 20s and 30s, but older age groups are also experiencing the increase, and we know that the risk for severe outcomes is higher for older people. And in fact, we are seeing an overall increase in hospitalizations. So not only are we seeing more transmission, but we're also seeing more severe cases and complications related to COVID, and these trends are quite concerning. Next slide, please. We're also seeing an increasing number of outbreaks across settings. So according to the latest data, there are 50 open outbreaks in York Region, including 20 in institutional facilities, such as long-term care home, retirement homes, and congregate care settings. We also have 19 workplace outbreaks and 9 outbreaks in childcare centers. In addition, there is currently 1 school outbreak. However, in addition, there are about 50 schools currently under surveillance, which means that there was at least 1 case in the school setting that is being managed and investigated, but they're not yet meeting outbreak definition. Next slide, please. So moving on to some updates from the province. Because of this increase in the number of cases and outbreaks, there were additional measures implemented in our region to try to slow down the spread of COVID-19. So as we all know, York Region has moved to modified stage 2 restrictions on October 19th, which are to be in place for 28 days. And other municipalities with these restrictions so far are Toronto, Peel, and Ottawa. The specific modified stage 2 restrictions include the closure of a number of settings, including indoor dining at restaurants, bars, and food courts and malls, indoor gyms and fitness centers, gaming establishments, cinemas, and performing arts venues. Also prohibited are personal care settings where face coverings must be removed for the service, for instance, makeup application or beard trimming. In addition, there are limits on the size of private social gatherings and also organized public events, which are really for indoor gatherings, a limit of 10 and outdoor limit of 25. Also, team sports are now limited to training sessions only. Outside the modified stage 2 restrictions, given this rise in cases, a number of precautions and restrictions have also been implemented at long-term care homes, retirement homes, and congregate care settings such as group homes and shelters in York Region and several other areas. So for instance, at long-term care homes, essential visitors are now the only visitors allowed, and short-term and temporary absences for social or personal reasons are suspended. And these measures are really important for protecting the more vulnerable populations in our region. Next slide, please. There are also a number of preventive measures that individuals can use to protect themselves and others. York Region Public Health has been actively communicating these messages out to the public. And healthcare providers may play a role in conveying these messages to patients as well, given the trusting relationships that you have built with your patients. Also, you're encouraged to follow these tips as well to help protect yourself, your patients, and your loved ones. So these measures are to, as mentioned earlier, limit contact with those you don't live with. So those who live alone may consider having contact with another household. So it's really important to avoid social gatherings and crowds, and also to avoid non-essential travel. If that's not possible, it's important to maintain physical distancing of at least 2 meters. And if you must be within 2 meters of someone outside your household, please wear a mask or a facial covering. Taking care to wash your hands frequently and thoroughly, and cough or sneeze into your sleeves, and avoiding touching one's face with unwashed hands. If there are any symptoms, even mild ones, it's important to stay home and get tested. In addition, high-touch surfaces should be regularly cleaned and disinfected. And lastly, it's helpful to download the COVID Alert app for free to be informed of exposures to the virus and to notify others if they were exposed. Next slide, please. So especially given what we know about transmission occurring in social gatherings, the province provided additional public health advice for Halloween for areas with modified stage 2 restrictions. And essentially, the traditional door-to-door trick-or-treating is not recommended, and people should consider alternative ways to celebrate. And you can find more information at the link provided here. So now I'd like to go through a few updates to provincial guidance that were made since our last webinar. The first one is the quick reference guidance on testing and clearance. And this revised version was published on October 1st. There was a change in the non-test-based clearance approach. So now, to determine when a COVID case can be cleared, we need to assess the severity of illness and whether the case has severe immune compromise, and the specific conditions are listed in the document. But these generally do not include diabetes, end-stage renal disease, or advanced age. If the case has only mild to moderate illness and no severe immune compromise, then they would isolate for 10 days, counting from the symptom onset, or if they remained asymptomatic, counting from the specimen collection date. On the other hand, if the case had severe illness, meaning requiring ICU level of care, where they had severe immune compromise, they would then need to isolate for 20 days. In addition to these time-related criteria, which were different from the previous 14 days, in order to clear a case, they must also meet symptom-related criteria. So they must be afebrile without the use of fever-reducing medications, and they must have symptom improvement for at least 24 hours. It's also important to distinguish the time required for clearance from the incubation period, and really note that the close contacts of cases, meaning those who had high-risk exposures and those who traveled internationally, are still required to self-isolate for 14 days from their last exposure. So that duration has not changed and remains at 14 days. Next slide, please. So you likely already have seen this, but just a quick note that there was an update to the reference document for symptoms from the Ministry of Health in late September. And the focus is now on symptoms that are new, worsening, or different from an individual's baseline health status or their usual state. The symptoms should not be chronic or related to other known causes or conditions. This document also provides some examples of alternative causes or conditions for these symptoms. And essentially, anyone presenting with at least one symptom or sign from the document should be considered for testing. You should continue to use your clinical judgment during patient assessment, including considering exposure risks and local epidemiology. And of course, it's important to also consider atypical signs and symptoms, especially in children, older people, and those living with developmental disability. Next slide. There is also a new screening tool for children attending school or childcare. So children must be screened every day before going to school or childcare, and parents or guardians can fill this out on behalf of the child. This tool can be used for those up to 19 years of age who attend the school or childcare according to the ministry. So again, the focus is on identifying new or worsening symptoms that are not related to other known causes or medical conditions. And there are two symptom lists. List 1 has more typical symptoms of fever, chills, cough, shortness of breath, and decrease or loss of smell or taste. List number 2 has symptoms such as sore throat, runny nose, headache, nausea, fatigue, or myalgia. So if a child has any of the symptoms in list number 1, or if they have 2 or more symptoms in list number 2, then they should be advised to self-isolate and get tested. On the other hand, if a child presents with only 1 symptom from list 2, they should stay home for at least 24 hours since symptom onset. If the symptom then improves, they can then return to school or childcare when they feel well enough to do so. And they don't need a negative test to return. That being said, if the symptom actually persists or worsens, then they would need to contact the healthcare provider for advice or assessment. It's important to note that for certain people, even if they are asymptomatic, they should continue to self-isolate. So for instance, when they were deemed a close contact of the case, or if they traveled outside Canada in the past 14 days, or have been instructed by public health to self-isolate or received a COVID alert exposure notification. These people always need to isolate. Also to note here that anyone who tested negative but has persistent or worsening symptoms, they should continue to stay home as well and seek medical attention, and repeat testing should be considered in these situations. Next slide, please. There were also some questions from the last webinar about what to do when an individual in a school setting is not tested. The latest school outbreak management guidance document from the province appears to address this. So essentially, it would really depend on whether the individual is a probable case. And the definition of this is linked here. But basically, anyone who has symptoms compatible with COVID-19 and who was a close contact of a known case, or traveled to an affected area, or worked or lived in a facility known to be an outbreak, then they would be considered a probable case. For anyone meeting probable case definition, they must be managed as a case, and they should isolate for a period of time in accordance with clearance guidance presented earlier. So usually for 10 days if they also meet the symptom criteria as well. On the other hand, if a symptomatic person does not meet probable case definition, it would depend on if there's a known alternative diagnosis provided by a healthcare provider. So if there is a known alternative diagnosis, the person can return to school when their symptoms have been improving for at least 24 hours. On the other hand, if there is no known alternative diagnosis and their symptoms are compatible with COVID-19, they should again self-isolate based on the clearance guidance, and essentially they would be treated as a probable case. As mentioned in the previous webinar, healthcare providers are not required to provide a note to confirm that a child has an alternative diagnosis. However, parents or guardians can complete an attestation form, which is available on our website, and they may ask you for guidance on its completion. Next slide, please. So switching gear to COVID-19 testing, this may have been mentioned in the last webinar already, but in general, there is a move to focus on testing symptomatic and high-risk people. So in general, low risk and asymptomatic people would not be considered for testing. However, a few groups should continue to get tested, even if they're asymptomatic. For instance, again, contacts of confirmed cases should be considered for testing. And it's important to note that even if they test negative, they should continue to complete their 14-day isolation period, as they may still be incubating. And if they develop symptoms during that time or after, they would need to be tested again. Other asymptomatic testing may pertain to outbreak investigations or to high-risk populations, for instance, as part of targeted testing campaigns. Next slide. And where can people get tested? They can receive testing at an assessment center or pharmacy. Both would require appointment booking in advance. So they should be directed to an assessment center at one of the 4 hospitals in York Region if they are symptomatic or high risk, as mentioned in the last slide. And you can follow your local testing location's protocol about referrals. Otherwise, all other asymptomatic people can go to a pharmacy for testing. The locations can be found on the website provided on the slide. And those who get tested can find their results online at the link provided here as well. The important thing to mention is that if you ask the patient to get tested, to please remind them that they should be wearing a medical mask, and also they should make safe travel arrangements to the site. So for instance, not to take public transit. Next slide. Primary care providers can also test for COVID-19 if a number of criteria are met. So for instance, droplet contact precautions must be followed and cleaning and disinfection procedures should be in place. Patients must be isolated in a single room and be provided with surgical or procedural mask if tolerated. And of course, one must be familiar with the test itself and to be able to coordinate sample delivery. Next slide. In terms of testing modality, the gold standard continues to be PCR tests using nasopharyngeal swab. Other upper respiratory tract specimens, such as nasal swab or throat swab, are also acceptable, although MP swab is preferred when it is available. More recently, Public Health Ontario added saliva as an acceptable specimen type for PCR testing in patients for whom testing using another specimen is not possible or not tolerated. Of note, only a limited number of labs are accepting saliva samples for PCR testing. So this is something that the labs continue to work on, and you can refer to Public Health Ontario for more up-to-date information on this. Rapid testing has also been in the news lately, and this is being evaluated by the province. Rapid testing has the advantage of having a quicker turnaround time, but seem to have lower sensitivity, which makes further assessment important. Next slide, please. So moving on to immunization updates. Flu immunization is especially important this year, as you know, to help reduce burdens on our healthcare system, and as COVID may present similarly as flu. So it's recommended for anyone 6 months and older to get the flu shot. York Region Public Health recently currently has flu vaccine supply for both the quadrivalent inactivated vaccine and the high-dose trivalent inactivated vaccine products. If patients are inquiring about the new cell culture-based vaccine called FluCellVax, they can be advised that this will be distributed to pharmacies by a separate ministry contracted distributor, and it can be provided to those 9 years of age and older. Flu vaccine distribution is underway, but that being said, doses are received incrementally from the Ontario Government Pharmaceutical and Medical Supplies Services. So due to extremely high demand of orders received, some offices may not have yet received their vaccines, and all levels of government are advocating to get additional flu dose allocation. Also, as a reminder, both the QIV product and the high-dose TIV product can be used for your patients aged 65 years and older. Healthcare providers are reminded not to delay vaccinating your patients by waiting for a particular product. The most important thing is to vaccinate them as soon as possible. And you can use our order form for a publicly funded vaccine linked here. In addition to healthcare provider offices, pharmacies can also vaccinate anyone 5 years of age and older. In addition, public health has flu vaccine clinics for specific groups of people, which are those with no OHIP coverage, those under 5 years of age, and people aged 65 years and older who may have challenges accessing vaccines elsewhere. Next slide, please. So those at higher risk for COVID-19 and flu-related complications are also likely to suffer from pneumococcal disease, so it's best to protect them by ensuring that they're up to date with their pneumococcal vaccination. Pneumovax 23 is publicly funded for anyone aged 65 years and older and those who meet high-risk eligibility criteria. And Prevnar 13 is publicly funded for children from infancy to 4 years of age and those age 50 and older who meet high-risk eligibility criteria. And you can find information on high-risk eligibility criteria and dosing interval considerations in the publicly funded immunization schedules for Ontario. Next slide, please. So here are some additional resources for you. From York Region Public Health, we have a general link for vaccine information for healthcare professionals, and it contains the recent notices related to influenza vaccine ordering and also shingles vaccine ordering, which you should have received already. And as you know, the province has switched from Zostavax to Shingrix recently. Here are also some resources from the Ministry of Health, specifically the guidance for immunization services during COVID-19, which describes routine vaccination as an essential service and standard of care, and the publicly funded immunization schedule, which also provides up-to-date information on catch-up vaccines. In addition, Public Health Ontario has some information on influenza vaccines for this season and also on antiviral treatment for influenza that you can take a look at. And lastly, the National Advisory Committee on Immunizations, or NACI, has guidance on the use of influenza vaccine during the pandemic and guidance for vaccine delivery during the pandemic to improve safety, and also recommendations on the duration of post-vaccination observation period for flu vaccination, essentially recommending using a shorter post-vaccination period of between 5 to 15 minutes, only when specific conditions are met. So you can take a look at these additional resources. Next slide, please. So I've been speaking for a while, and it's now my pleasure to introduce to you my colleagues, Krista Richards and Kim Bakani Angus, who will be presenting some information on their health equity work.
Great, thank you so much, Cindy. Just a quick introduction. My name is Kim Bakani Angus. I'm one of the public health nurses on the health equity team. And just going to give a quick overview in terms of what we have kind of been doing in terms of supporting our health emergency operations from a health equity perspective. In late summer 2020, the health equity team embarked on a round of stakeholder consultations with service providers working to support some of York Region's most vulnerable residents. These consultations were initiated to better understand the lived experiences of vulnerable populations throughout this pandemic to date. However, there's been strong evidence that certain groups, depending on a number of social determinants of health, were being disproportionately impacted by COVID-19. A better understanding of how the public health response initially impacted individuals, communities, and stakeholders is planning to help to inform and support ongoing public health activities aimed to reduce the spread and transmission of COVID-19. So we spoke to about over 80 different providers throughout York, and what we had found was that there were some key number of populations that were identified as being more particularly vulnerable, experiencing unprecedented challenges and requiring tailored support and care. The 6 different groupings that came through our conversations included the following: persons living with disabilities, young adults 40 and under, residents without stable housing, low-income residents, as well as seniors and newcomers, which might be what you have been seeing along within your own practice. I'm going to pass it over to Krista Richards, our health promoter, who's going to talk about some of the consultation highlights in terms of what the dialogue and conversations uncovered.
Thanks, Kim. So we heard a number of different things from a number of different groups, and Kim mentioned we did talk to a large number of community organizations, and so these were organizations that are representing some of York Region's most vulnerable. So we're including seniors here, families without stable housing, food banks, organizations that support mental health, community health centers, so Vaughan CHC, and a number of other organizations that are working to better support our residents in the community. And so we heard a number of different themes, and I'm just going to highlight a few of them here. The first one being social isolation, and this was something that showed up in a number of those groups that Kim pointed out. And here we heard there was, an increased need for mental health supports, the move to virtual platforms. It did help people remain connected, but it left out those groups who either didn't have access to the equipment or didn't have the skills or didn't have the access to internet. That's been a big thing that's come up. And that sort of leads me into the next point here around digital inequities. There's been a lot of challenges with internet access in York Region. In some areas of York Region, broadband is not even an option. And with this limited access to internet and where a lot of the information is being pushed through, there is a greater risk of exposure to inaccurate information. And they're all, with different levels of health literacy as well, there are challenges with people being able to discern factual information online. So digital inequities has been a really big piece that has shown up during this COVID-19 pandemic, and it's been touched on in a number of ways. Access to public health has also been challenging for residents. Public health does offer a number of services that support vulnerable populations in normal times, and many of those services stopped to respond to the pandemic. And so I think there was a bit of a disconnect in the public understanding of the role of public health in COVID-19 and what that would mean for regular service and what that would mean for the response. And so that not being very well understood. And then in addition to that, barriers to accessing the public health unit to receive information or seek clarification, both from the perspective of the residents and from the different community organizations who were just looking for more information. And then lastly, when it comes to COVID-19 information, service providers have commented that they would benefit from a direct link to public health to convey messaging, and that the reliance on digital media for information and updates could have been challenging and made it challenging to adhere to guidelines. So the changing COVID-19 information, which I'm sure many of you are aware, as guidelines change, things like that, lots of things that we're not in control of, but from a public perspective did provide a few barriers to really understanding what was going on. So those were some of the main highlights, and there are some more things that we heard, but these are the pieces that most people resonated with. So I'll pass it back over to Kim for her to talk a little bit about what we're doing with this information.
So in terms of the consultations, what we're hoping is to inform how we can shift or redirect some of our public health activities in terms of a future direction and rebuilding and recovering from COVID. What we're going to be doing is taking some of the highlights from the community assets that were identified during the emergency response for future collaboration and potential channels for direct public health action. Examples of these might be pop-up testing sites, which we've already started to look into and lean into. Another piece will be supporting policy advocacy with our community groups and partners to address health inequities that have been further highlighted during the pandemic. As you can see, a lot of our various service sectors are really leaning into grants and funding proposals to be able to look at how we can rebuild to address some of the inequities that already pre-existed before the pandemic, but have been highlighted in terms of where there really needs to be some gaps or concentrated efforts to be able to close those gaps. And finally, we're going to be looking at that knowledge translation opportunity for both our internal and external partners, trying to understand what the lessons learned in terms of how to better support our vulnerable populations as we build back, and how we can work with our community partners, including yourselves, in terms of how we can best address vulnerable populations following this pandemic. So I'm going to go on to the next slide, which I believe will bring us to our Q&A period. I see that there are some live event Q&A posted, and I'll pass it back over to Cindy.
Thank you very much, Kim and Krista. So thank you so much for all your questions and comments. I am looking over them, and the first one is when a child has one symptom from list 1 from the screening tool, or 2 of the symptoms in list 2, some schools have been sending all siblings home. And the question is that what is supposed to happen? So that's a really good question. And essentially, what would happen to siblings would hinge on whether a child is deemed a probable case. And there was a link to case definition in one of the previous slides. And so if a child is deemed a probable case, meaning that they're symptomatic and they had a close contact of a known case, or they've traveled in the past 14 days to an international destination, then they will be treated as cases. They themselves will need to isolate, but also their household contacts, including any siblings, will also need to isolate. On the other hand, if the child is not a probable case and their household contact, including siblings, remain asymptomatic, then they may only need to self-monitor. And of course, public health is there in situations like this because there may be nuances, and we'll be helping to make that determination as well. But in general, these are the rules. There's another question. Does a school-aged child need to isolate at home if a family member in their home arrives from out of the country? And so firstly, for somebody who's returning from another country, they themselves would need to isolate or self-isolate. This means that they're not supposed to go out, but also even at home, they should be in their own room ideally and not sharing common space with others. And they need to be masked and maintaining physical distancing with their household members. And Public Health Ontario actually has a specific one-pager on self-isolation, which you can also refer to when speaking to your patients about the specifics. So in general, they're supposed to be self-isolating already. Now, if the family member becomes a probable case, again, as mentioned earlier, if they actually develop symptoms and they've returned from out of country, then they, again, will be treated as a case, and any household contact, including their children, would need to isolate as well. So I hope that answers your question. I'm trying to see if there's another question here. I think there was another question pertaining to any new antigen tests, and essentially the province is maybe looking into additional testing modalities, and so we'll have to stay tuned for any additional information regarding any new testing methods for COVID-19. I'm not sure if there's any additional questions here. So there's another question: if someone is COVID positive with symptoms, how long does the household contact have to it keeps moving, have to isolate for? So if someone is COVID positive, so as I mentioned earlier, any contact of a confirmed COVID case, so including household contacts, will need to look at their incubation period, right, which is 14 days. So that's why they have to all isolate for 14 days. And they should also be tested during the 14 days. And in addition to that, if they develop any symptoms, they will have to be retested. There was a question about York Region Public Health holding flu shot clinics in Richmond Hill. There are flu shot clinics available, and there should be some information available on our website. Perhaps that could be sent out in the follow-up Q&A documents as well, but there should be information available on our website related to our clinic times and locations. So I think those are all the questions that we have received so far, and we're at 12:55 right now. So perhaps we can wrap up this webinar. So thank you again for all of your questions and comments. As mentioned, if there are any other questions that we're not able to address during this session today, it will be compiled and a follow-up Q&A document can be shared with you through our Public Health Matters email list. And so please subscribe if you haven't yet done so, and also invite your colleagues to subscribe as well. Okay, next slide. So the best way to sign up to Public Health Matters is to go to york.ca/healthprofessionals and click on the tile that says e-newsletter for healthcare professionals. Next slide. There are also a few helpful links that you can bookmark to stay up to date. Some York Region web pages are listed here, including the Health Professionals page and our data dashboard. There is also a general link for COVID-19 where you can find weekly COVID-19 videos from our medical officer of health, Dr. Kurji, if you wanted more frequent and general updates related to COVID-19. And also to note here, Public Health Ontario and the Ministry of Health also have COVID-19 specific pages that you can check out. Next slide. So this is to remind you that if you have any questions, you can call the dedicated health professional COVID-19 line at the number here. Next slide. And I think that's it for the webinar today. Thanks again for joining. Please remember to subscribe and hopefully see you at the next webinar.